You're welcome to the reproductive health segment with Dr. Ajayi. My name is Dr. Abayomi Ajayi, and this week we are continuing our discussion on male factor infertility. And to do justice to that, especially talking about the lifestyle factors that affect male fertility, is Dr. Bukumi Kolade. Dr. Kolade, you're welcome to the program.
Thank you very much.
By the way, Dr. Kolade is a consultant gynecologist and a fertility expert, so he's the right person that we can talk to about this topic. So, Dr. Kolade, can you shed some light on some of, maybe before we go into that, there's some things that are showing up in other parts of the world now. We're seeing that male factor infertility appears to be becoming more rampant, if not an epidemic. Yeah. It's shown that in the last 30 years, sperm count has decreased significantly. Good. And the very disturbing report from Denmark showing that about 1 in 5 out of every 5 of men between 15 and 35 have deranged sperm count. So based on that, and then looking at lifestyle factors, so that's why we're having this topic today. Can you shed more light on these life factors that affect fertility?
The important thing for us to know about lifestyle factors is that there are things that has taken place over the last so many years, 5, 10, 15, 20 years. So many times it's the cumulative effects of these things that we get to see. Very important among these lifestyle factors, we have things like smoking, okay, exercises or lack of it, infections, and things like use of recreational drugs like marijuana, use of cocaine, use of even anabolic steroids, abuse of antibiotics. All these things have a place to play in terms of lifestyle affecting male fertility. Okay.
Can we go into more details? Let's look at, for instance, smoking.
Yes. Well, smoking, it's a very, very important factor when we talk about lifestyle considerations in male infertility. This is because the act of smoking releases several toxic chemicals into the system. And all sperm parameters are affected in smokers. I'm talking about the sperm count is affected, the appearance of the sperm cells affected, the ability of the sperm cells to move are also affected. In fact, it has been shown that when you collect the seminal plasma in a smoker and you put sperm cells in someone that is not smoking into it, the seminal plasma, it kills the sperm cells because of its toxic nature of the things released into the seminal plasma in smokers. So it's a very important factor for male infertility.
Well, is there any allowable quantity? Or the answer is no, 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 or there is an allowable quantity?
For smoking, it's better to stop smoking. It's better to stop smoking for smoking, yes.
Good. Now, let's talk about alcohol. You also mentioned alcohol.
Alcohol, yes, alcohol, it's also an important thing. Apart from affecting sperm parameters, alcohol also causes abnormalities of erection. People talk about weak erection, premature ejaculation, all those things. Alcohol has a place to play in that. Well, for alcohol intake, they say if you reduce to 2 to 4 shots per week, it's still tolerable. Because like we probably know, there's a beneficial effect of alcohol, especially in heart conditions. So it may not be no, as in smoking, but reduced to 2 to 4 shots in a week.
Good.
Yes.
What about exercise? You also mentioned exercise.
Yes, exercise, well, talking about exercise, it's important for us to realize that moderate exercise is the thing. We don't want excessive exercise because we understand that excessive exercise also has its adverse effects. By moderate exercise, I'm talking about if it's running, not running more than 100 kilometers in a week. If it is cycling, not going more than 80 kilometers in a week. But things like brisk walking in front of your place, things like swimming, even things like playing table tennis, like doing push-ups, moderate exercise, yes, they are beneficial. Because we know that by the time someone gains excessive weight, the sperm parameters begin to decline. Yes, so moderate, I'd like to say this also, moderate exercise is also useful for people that have erectile abnormalities. Someone not able to have intercourse for the number of times she used to in the past, or premature ejaculations, those kind of things. Exercise have been shown to improve those things also.
Good. So you also mentioned some recreational drugs.
Recreational drugs, yes. Well, we don't get to talk about this too many times, but the truth of the matter is that it is being practiced in these parts of the world. There's a lot of marijuana use all over the place. There's a lot of cocaine use, we want to admit it or not. These things have effects on sperm parameters. For instance, marijuana, effect of it lasts in testis for more than 2 weeks on the testis, and it affects all the functions of the sperms. I'm talking about the motility, the appearance, and the count of the sperm. This is with cocaine. Another common drug that people tend to use are anabolic steroids, especially people that exercise, people that body build, and all those people. The anabolic steroids, they have an effect on the hormones that are responsible for sperm function. So indirectly, they have an effect also on sperm function.
Okay.
So marijuana, cocaine, anabolic steroids, yes, they have very severe adverse effects on male sperm functions.
And if I remember correctly, you also mentioned antibiotics.
Antibiotics, yes.
Good. Any specific antibiotics that
well, antibiotics, the place of antibiotics is actually twofold. One place is somebody has painful urination and uses antibiotics for 2 days. There's a place of that. Incompletely treated infections, which is very, somebody just walks into a shop and say, oh, give me this drug. You understand? So those things happen. So there's a place of incompletely treated infections. That's a very strong one. Other drugs that affect male fertility are actually things like cimetidine. Some of them are things like testosterone injections that are given for some other things. They tend to affect male hormone functions and indirectly affect sperm function also. Especially also some antihypertensive drugs also tend to do that, especially affecting sperm function and ability to have erections, leading to erectile dysfunctions.
Now, when you just mentioned this, you know, some time ago, I mean, I'm sure some people still do it, that once there is male factor, they give you sustanon, and you're on it like forever. Does that, from what we're saying now, that's really counterproductive?
No, it's actually counterproductive because sustanon is testosterone.
Yeah.
And what it does is that it takes over the function of testosterone being secreted by the body. So the body doesn't secrete it anymore. It affects erection, it affects sperm function. It actually is counterproductive.
Okay. One other thing that we need to mention is coffee.
Yes.
What is the effect of coffee on male factor?
Well, the effect of coffee, the caffeine, it has an effect on sperm function. So we say, well, limit it as much as possible. Not more than 2 cups per day is still acceptable, yes, for where coffee is concerned.
Good. Because we need to just rush some things now. Stress. Is there any role of stress in?
Well, especially as regards erection, yes. Like most people know, when you're under psychological stress, you may not be able to have intercourse properly.
That's right.
So there's a place to learn to relieve these things. Unfortunately, in this part of the world, we don't have too many facilities for that. But I mean, as we're advancing, I believe that those facilities are coming up gradually to aid us in relieving these things.
Well, on a positive note, any place for supplements in male factor infertility?
Yes, thank you very much for that. Now, male factor infertility supplements are very useful, especially when they are rich in antioxidants. This is because you know that as cell division occurs, some radicals are released. These are poisonous to sperm cells. So antioxidants, vitamin A, vitamin C, vitamin E, if it contains selenium, it will be quite useful. Not necessarily in improving the sperm count, but sperm function. Sperm function, they are quite useful in doing that.
Is there any drug is there any sperm booster?
All the things that you've heard about sperm boosting, they are all claims. We've not found any drug that has consistently been shown to improve sperm parameters. Even people that do surgeries, those surgeries at the very worst, at the very best, cause some improvement. After a while, it begins to decline. So we've not had any intervention really that has consistently has a positive effect on sperm parameters.
Dr. Kolade, it's been wonderful having you on this program.
It's a pleasure.
Thank you for coming. Viewers, it's on that note that we end this week. We'll see you next week.